Ever heard of beta thalassemia? It's a term medical students often grapple with. You see, this term might sound like some alien language to some, and even to those in the medical field it can be a bit of a brain teaser. Despite its intimidating name, beta thalassemia is a common topic that often comes up in medical discussions and health forums. Now you might be wondering, scratching your head, so what exactly is this beta thalassemia? Well, stick around to find out. Beta thalassemia, in the simplest terms, is a blood disorder. Now let's break that down. Our body is like a complex machine, and every machine needs fuel to run. For our body, that fuel is oxygen, delivered to various parts by our blood. Hemoglobin, a protein in our red blood cells, plays the role of the delivery guy. However, in the case of beta thalassemia, there's a glitch in the system. This glitch is a result of a genetic mutation that affects the production of hemoglobin. Instead of the usual healthy hemoglobin, the body produces a variant that's not up to the task. Sort of like if our delivery guy showed up to work with a flat tire. As a result, the body doesn't get the oxygen it needs. This lack of oxygen can lead to various complications, the most common of which is anemia. Anemia is a condition characterized by a decrease in the total amount of red blood cells, or, more specifically in this case, a lower than normal level of hemoglobin. People with anemia often feel tired or weak, as if they're running on empty. In essence, beta thalassemia is a disorder that messes with our body's fuel delivery system. It's a complex issue wrapped up in a simple phrase, a blood disorder. Now that you have a basic understanding of beta thalassemia, let's delve into the signs and symptoms. Identifying beta thalassemia can be tricky, but certain signs and symptoms can give it away. The most common signs include fatigue and weakness. These occur due to the body's struggle to transport enough oxygen to its cells and tissues. Individuals with beta thalassemia may also exhibit pale or yellowish skin, a symptom of jaundice, caused by the rapid breakdown of red blood cells. Facial bone deformities are another sign, as the body tries to produce more blood cells in the bone marrow, causing bones to expand. In children, beta thalassemia might lead to slow growth and delayed puberty. Abdominal swelling, often a result of an enlarged spleen, is another typical symptom. Lastly, dark urine, a sign of rapid red blood cell breakdown, can also indicate beta thalassemia. Recognizing these signs and symptoms can be the first step towards diagnosis. Knowledge of these symptoms aids early detection. But how do laboratory findings confirm beta thalassemia? Lab tests play a pivotal role in diagnosing beta thalassemia. When it comes to confirming a diagnosis, blood tests are the mainstay. A complete blood count, or CBC, is usually the first step. This test measures different parts of your blood, and in beta thalassemia, it could reveal anemia, a common sign of the disease. Now, anemia alone doesn't confirm beta thalassemia. That's where hemoglobin tests come in. Hemoglobin is the protein in red blood cells that carries oxygen, and in beta thalassemia, it's often abnormal. A hemoglobin electrophoresis test can identify the different types of hemoglobin present, potentially detecting the abnormal form found in beta thalassemia. To further confirm a diagnosis, genetic testing can be used to identify mutations in the HBB gene, which are responsible for beta thalassemia. With these tests, a diagnosis of beta thalassemia can be confirmed. Now, let's wrap up everything we've learned. So, we've discovered quite a bit about beta thalassemia today. To recap, beta thalassemia is a blood disorder that reduces the production of hemoglobin. Hemoglobin is an iron-containing protein in red blood cells that carries oxygen to cells throughout the body. In people with beta thalassemia, low levels of hemoglobin lead to a lack of oxygen in many parts of the body. Symptoms of this disorder can range from mild to severe, including fatigue, weakness, pale or yellowish skin, facial bone deformities, slow growth, and abdominal swelling. These signs and symptoms are caused by the body's need for more blood and the spleen's role in red blood cell destruction. Diagnosis happens in the lab, where blood tests reveal small, abnormally shaped red blood cells and a reduced amount of hemoglobin. Genetic tests can also confirm the presence of mutations. And that, folks, is a quick dive into the world of beta thalassemia. Stay curious, stay informed, and keep learning.